Welcome to EPG Pathshala on the subject Social Medicine and Community Health. I am Professor Vidya-mitra and I shall be discussing Millennium Developmental Goals module, which belongs to the paper Healthcare Delivery System. This module has been developed by a team comprising of myself, Professor Devendra Kumar Taneja from MAMC New Delhi. I am the content writer, and this content has been reviewed by Professor J. Tandon of the Department of Community Medicine, IMS, BHU, Varanasi. The learning objectives that have been set for this module is number 1, to define Millennium Developmental Goal, to enumerate goals of MDGs, and to list goal-wise targets and indicators of MDG, and to pinpoint achievements of MDGs, and last but not least, to specify lessons learned from MDG, along with to identify limitations of Millennium Developmental Goals. MDG program was initiated in the year 2000 at a global meet, and in order to reduce worldwide poverty and human deprivation, the world leaders came to work together to meet concrete targets for advancing achievement and reducing poverty by 2015 or earlier. Poverty was considered as the main culprit for advancement of health of the globally, and that is why in the MDGs this received top priority. Since year 2000, MDGs has been considered as the world's biggest promise. World's biggest promise in terms of socio-economic development, historic commitment and a global agreement to reduce extreme poverty and improve the health and welfare of the poorest people within 15 years. So the MDG goals that has been set for the year 2015, taking base year as 1990. Goals that have been specified in this program. In 2000, United Nations Millennium Development Declaration committing their nations to new global partnership to reduce extreme poverty and setting out a series of targets with a deadline of 2015. This has, out of the goals that have been set, 8 goals, it has 6 out of 8 goals, 9 out of 18 targets, and 18 out of 48 indicators which are related to health. However, India has only 12 out of 18 targets considered as relevant for this country. Goal-wise and targets and indicators of MDG have been set to monitor the progress over the years. And first goal, as I said earlier, refers to extreme poverty and hunger. And within this goal, the target that has been set, number 1, halve hunger between 1990 and 2015, the proportion of people whose income is less than $1 a day. And for that, 4 indicators or 3 indicators have been considered more important. One is poverty head count ratio, poverty gap ratio, and share of the poorest quintile in the national income. These 3 indicators have been considered important for this target. The target number 2, referring to this goal, extreme poverty and hunger, is halve between 1990 and 2015, the proportion of people who suffer from hunger, that is prevalence of underweight children under 5 years of age. This was taken as an indicator, and for that criteria has been has been monitored on this prevalence of underweight in children under 5 years of age. Goal number 2 refers to universal primary education, because education has been considered a significant input for human resource development. Now, the target that has been set for this ensure that by 2015, children everywhere, boys and girls alike, will be able to complete a full course of primary schooling, that is 100%. And indicators for this has been net enrollment ratio in primary education, proportion of pupils starting grade 1 who reached last grade of primary, and literacy rate of 15 to 24 years old women and men. Goal 3 refers to promote gender equality and empower women. In this context, certain indicators and targets have been identified. The first target is eliminate gender disparity in primary and secondary education, preferably by 2005 and to all levels of education no later than 2050. In order to measure this target, indicators have been ratios of girls to boys in primary school and secondary and tertiary education, share of literate women to men 15 to 24 years old, share of women in wage employment in the non-agriculture sector, and proportion of seats held by women in national parliament. These indicators clearly indicate that if you want to empower women, we have to take into account various other issues, because a woman will be employed only and only if she is educated, she is employed, she has her own income, particularly in the socio-economic context. In reproductive and child health, the context may vary, but in case of general development, education, employment, and equity in all spheres of life becomes very, very vital. And equity and equality issue has to be considered in promotion of gender differences. The goal 4 refers to reduction of child mortality. Since independence, it was realized that child mortality is very significant globally as well as in India as well, and this refers to reduction of child mortality, and the indicators that have been seen reduce under 5 mortality by 2/3. And this indicators for this has been under 5 mortality, infant mortality, and proportion of 1-year-old children immunized against measles, because measles has been taken a critical vaccine to assess this reduction in child mortality. Goal 5 refers to improve maternal health, because maternal mortality ratio, although it has come down drastically, that is near about 116 per 100,000 live births, but still this is average statistics for the country. There are some states like UP, Bihar, they have high maternal deaths, still maternal health deaths. And unfortunately, the causes are preventable. In spite of that, the majority of the causes, like hemorrhage, sepsis, obstructive labor, we can take care of. So, improvement of maternal health, and so the target that has reduced maternal mortality by 3/4. Earlier it was 100 for 100,000 live births. Now we want to reduce it to 100. Maternal mortality rate and proportion of births attended by skilled health personnel. Target 6 refers to combat HIV, AIDS, malaria, and other diseases. We all know that each and every country, majority of the countries are facing these problems, and so we have to combat HIV, AIDS, malaria, and other diseases. For this, have halted by 2015 and begin to reverse the spread of HIV and AIDS. And for this, the targets have been HIV prevalence among 15 to 24-year-old pregnant women, condom use rate of contraceptive use prevalence rate, and condom use of last high risk sex. Have halted by 2015 and begin to reverse the incidence of malaria and other major diseases. Prevalence and death rates associated with malaria is one indicator. Prevalence and death rates associated with tuberculosis is another indicator in this. Goal 7 refers to ensure environmental sustainability. A lot of initiatives have been taken in this regard, and the target that has been to integrate the principles of sustainable development in the country's policies and programs and reverse the loss of environmental resources. So, preservation of environmental resources, that is plant development, has been key issues, and integrate the principles of sustainable development in the country's policies and programs and reverse the loss of environmental resources have been the target set under this goal. The indicators that have been proportion of land area covered by forests, ratio of area protected to maintain biological diversity surface area, energy use per unit of GDP, and carbon dioxide emissions per capita, and consumption of ozone depleting chlorofluorocarbon, ozone depletion potentials, and proportion of household using solid fuels. Goal 7 had other indicators as well. Halved by 2015 the proportion of people without sustainable access to safe drinking water and basic sanitation. The indicator that for this component has been proportion of population with sustainable access to improved water sources, both in urban and rural areas, and proportion of population with access to improved sanitation, both in urban and rural areas. The next target has been by 2020 to have achieved a significant improvement in the levels of at least 100 million slum dwellers. Slum population as percentage of urban population is the indicator used for this. Slum growth, slums are mushrooming in metros, and not only in metros, in other cities as well. And therefore, slum population as percentage of urban population has been taken as a key indicator for this purpose. Goal 8 refers to develop a global partnership for development, because development cannot be achieved unless there is it is a global agenda, and partnerships exist at every level of activity. And therefore, ensuring global partnership for development has been considered as a key issue while developing MDGs. The target for this is, in cooperation with private sector, make available the benefits of new technologies, especially the information and communication technology. And the indicators for this has been telephone lines and cellular subscribers per 100 population, internet subscribers per 100 population, and personal computers per 100 population. So access to information technology and use particularly has been considered a key indicator for this. As long as we have discussed the various goals, targets, and indicators of MDG, now we are going to discuss on what India has achieved in MDGs. The various goals that have been set in MDG pertain to poverty, primary education, gender equality, reduction of child and maternal mortality, then environmental sustainability and global partnership. Although I'm not going to discuss the achievement in goal-wise achievements, but some of the significant achievement that has taken place in India is, number one, is in reduction in infant mortality to the level of 40 or around 40. At the time of independence, the infant mortality rate of India was quite high, around 160, and even at 1990 it was quite high. And now we have come to a very decent or reasonable figure of 40, and infant mortality rate is considered one of the very significant and comprehensive indicator of reproductive child health in any country. So this can be considered as a very significant achievement of India. Although under 5 mortality has come from 123 to 48 per 1,000 live births, remarkable progress. And this still miles to go, but certainly we had been on the very right path, and under 5 mortality has been substantially brought down, because most of the causes are preventable in related to child mortality are preventable. The only worry is that neonatal mortality has not been brought to that level, and Government of India is committed for that also. Now these two indicators are averages. Our achievements are, the figures that are quoted here are average statistics in the country. India is a very diverse country, many states, many regions with differential mortality and morbidity, So, but looking at the reduction of maternal mortality to level, that is the commitment was very high, and that taking the base figure of 1990 will come to 3/4 in the maternal mortality. But maternal mortality has come out to a level of 167. But there are certain states in the country which have very high figures. That is around 300, like UP and Bihar and so on. We all know that the causes of maternal mortality are mainly prematurity. The causes are mainly, most important cause is hemorrhage, sepsis, and other causes, obstructed labor. And these causes are preventable. Efficient mechanisms have been developed, and maybe we have come to very low level at 167. The target is around 100. Still, we have to go a lot. HIV prevalence in the population is stable, and that's very significant achievement. And it has low level as 0.26%. Tuberculosis is a global emergency, and DARTS programs in India, that is directly observed treatment short course therapy, has made rapid progress at a high cure rate of about 85%. But the worry part is that MDR and XDR, that is multi-drug resistant tuberculosis and extensive resistant tuberculosis, are becoming a major problem. Vector-borne disease remains a potential threat. This is malaria. There are many paradigms in malaria, and malaria problems are still quite high in spite of all commitments, though success has been achieved. Dengue epidemics, outbreaks are quite common. JE outbreaks are still posing a potential threat. So vector-borne diseases, in spite of all commitments, they still remain a great threat. Now, if we summary of it, looking at the summary of India's achievement in MDGs, we can classify India's achievement basically into three categories. Category number 1, achieve. Category number 2, near to achieve. Category number 3, far away to achieve. Achieved, near to achieve, and far away to achieve. These are the three basic categories. Under achieved categories, target of halving the PHCR, eliminated gender inequality in primary and secondary education. Now, gender inequality in primary and secondary education, that has been eliminated, but education is one area where a lot of emphasis has been taken out. Only quantitative issues will not take into consideration. You have to take into quality of education and other important dimensions. Achieve the required trend in reversal in the fight against HIV, AIDS, malaria, and TB. As I said earlier, that in malaria, drug-resistant malaria, in TB, drug-resistant tuberculosis, particularly multiple drug-resistant tuberculosis, multi-drug resistant tuberculosis, and extensive drug-resistant tuberculosis are potential threats. Targeted drinking water facility, though it has been achieved, but waterborne diseases are still quite a big problem. So we have to take particularly seasonal outbreaks and other things that have to be. Improve drastically the telephone and internet penetration. In fact, telephone is now being used as a input for provision of healthcare, and internet penetration has also been quite impressive in this country. Near to achieve universal primary education in terms of on quantitative indicators, but qualitative issues remains there. Reduced child mortality, almost near to that, but there is a difference between being near to achievement and being achieved. Maybe because, as I said earlier, that the neonatal mortality rate has remained stationary over the last decade. Though strategies are being evolved to take care of neonatal mortality, and unless we reduce neonatal mortality, because 2/3 of infant mortality is being contributed by neonatal mortality. Reverse the loss of environmental resources. Population is rising. The developmental processes are not able to take account, and particularly in the field of agriculture and other things. So preservation of environmental resources for the future generation is still though we are going on the right, moving on that path, but there are many challenges in these areas. Improvement in the coverage of forest area, there has been some improvement in this regard. Reducing emission of carbon dioxide emission, we have some success reducing particularly CFC emission, but carbon dioxide emission is far away to achieve. Half the proportion of people suffering from hunger, in spite of so much progress in socio-economic development. Poverty is still a big threat. If you go by World Bank criteria, many people are still below poverty line, and hunger is still persisting in our population, and particularly hidden hunger, that is a deficiency of micronutrient deficiencies, are a big problem. Reduction in maternal mortality rate by 3/4, that is reaching to the target of 100 from 167, is far away to achieve. And when we come to a particular lower levels, achievement becomes more less. Half the proportion of people without sustainable access to basic sanitation. Basic sanitation is particularly provision of latrines, reduction in open field defecation. There are many challenges still in that. Carbon dioxide emission per capita has not been declining. So this is a potential. So we have to look into not only the basic issues in environmental sanitation in terms of safe water supply and basic sanitation, but other issues in terms of greenhouse effect, in terms of global warming, and other issues has to be taken into account. Because there is a paradigm shift, there are epidemiological shifts because of changing environmental patterns. Now, we have to consider limitations of MDGs from two angles. One is that in future we can take lessons from this, that what was the impact of this limitation in achieving our goals. Basically, limitations of MDGs can be classified into, number one, limitation in the developmental process. What has been lapses in the developmental process of MDGs? The second is limitations in MDG structure itself, and third is limitations in content of the MDG, and fourth is limitations in implementation and enforcement. Okay. And these limitations in cumulative way had been responsible for the situation of achieved or not achieved in a particular activity. And the progression of MDG definitely depended on how the process was developed, how the structure was evolved, and how implementation and enforcement of a particular program was taken into account. Limitations in developmental process, it was a donor-centric agenda, and we all know that donor-centric agendas have their own self-life. As long as funding is there, things goes on. Once the funding is stopped, things stops. Unless the system has been, or the process has been evolved in such a manner that once the system is off, the funding is off, people can take into account, and it becomes an integral part of the national development. The second important limitation in developmental process was some of the important issues embodied in the Millennium Development Declaration. All issues could not be considered by many issues, many countries, when India has not taken into account all targets and indicators. Significant influence of the World Bank in setting indicator of poverty reduction. Poverty reduction, because poverty definition has to be taken into local context, and although the World Bank criteria has been provided a framework for assessing global comparisons, but area-specific issues have to be taken into account in defining poverty and evolving indicators for poverty reduction. The second aspect, that is, what were the limitations in MDG structure or basic framework? The first was reduced list of goals and neglected interconnectedness. Basically, if you look at all the MDGs, barring one or two, most were disease-oriented programs. That is the reduction in mortality component. But we have to talk in terms of overall development of the people. So, reduced list of goals and neglected interconnectedness was one limitation structure. Failure to account for population dynamics, because in many areas there is a population explosion, implosion, migration, and other issues, and these itself poses very serious threats. Say, for example, development of urban slums has been this evolved newer dynamics, and now government of India is thinking is in the process of implementation of urban health issues based on the principles and philosophies of primary health care by evolving urban health infrastructure. So, failure to account for population dynamics has been a very significant limitation in MDG structure. Failure to account for differences in initial conditions, because each countries were in different phase of development, although flexibility was given, but certainly if a person is at very low level and reaching to a particular high level, it will take time. The failure to account for differences in initial conditions in the structure itself. MDG present an agenda rather than the development strategy. The goals were in the agenda form, and what we require for achievement is a strategy. The strategies were left to develop. Each and every country was given the flexibility of their own strategy. Flexibility is a hallmark of success, but certainly too much flexibility may be also dangerous. MDG monitoring was often perceived as a top-down exercise. This should have not taken place. Limitation in the content of MDGs. Content-wise, equality, which was defined as a clear value of Millennium Declaration, was insufficiently addressed in MDGs. We have to take into account whether we are talking of equality or we are talking of equity issues in healthcare. Because if we concentrate on women empowerment, women empowerment is basically revolves around 6 E's. One is education is employment, then next is employment, third is income and economic security, and then there are 3 important E's, particularly in context of reproductive and childhood, because maternal mortality reduction, child improvement was also goal number 4 and 5. If that has to be taken into account, then we have to take into account that is equality in terms of provision of reproductive and childhood services. World Bank poverty line is not appropriate for all countries. Targets and indicators are unfair to poor countries and focus on only 3 direct aspects of health: maternal mortality, child mortality, specific diseases. Although malaria, HIV, and tuberculosis was also talked about into that. Little emphasis on environmental issues, in particular climate change and local challenges. So, long-term perspective of environmental issues has to be taken into account. Although issues have been discussed, touched upon, but in order to make a significant impact, there has to be many more focuses and more attention has to be taken into account. Only one goal focusing on commitment by development partners, the global partnerships. This was an initiative where more inputs to have commitment by developed countries are required, and that were lacking in this. So, just to summarize, that in this session we have discussed what is development, and particularly when Millennium Development Goals were evolved in 2000, taking base year as 1990, this provided a framework for each and every country to move on the socio-economic path, and each and every country devised their own strategies to achieve targets and various goals that was set in the MDGs, and India's commitment and India's progress in this on the goals path have been uneven. In some areas they have achieved, in some areas they have a greater achievement, and in some areas they have failed. However, it goes without saying that MDGs has made a significant progress in India in terms of poverty reduction initiatives, in terms of education, primary education and secondary education, in terms of reducing gender inequality, in terms of reduction of maternal and child mortality, in terms of reduction of reversal of things of malaria, HIV and tuberculosis. However, it goes without saying that the burning issue of MDR, multi-resistant tuberculosis and extensive tuberculosis and also resistant malaria cases are still there, and also it has moved on certain path of total environmental improvement through total sanitary campaign. But there are still wider issues are still left, and global partnership initiatives have been taken in that area also. So we can say that this MDGs platform has provided a very significant input, and for India, and India has made has progressed quite satisfactorily on the path of MDGs. Thank you very much for visiting ETC Barcelona.